Hi, I'm Dr. Hall, and I just wanted to visit with you about the NeoGraft hair transplant restoration technique. This is something that has worked very well now for our patients and myself, in that it is an improvement in the technology of hair transplantation.
Hi, my name is Tricia Hall, and my husband and I are the owner of Hall Plastic Surgery and Rejuvenation Center. As a female, I have a receding hairline that has always bothered me.
Basically, we can take the hair and transplant it from the scalp to the areas which we want to fill in, which is usually the front hairline, as well as sometimes the top of the head on the back. I think is exciting is where we take the hair from is really minimal healing and recovery.
So this is my donor site, and we're using the NeoGraft system. So you see that they're extracting one hair follicle at a time. The area, you have a localized numbing agent. I always use a scale of 1 to 10 when I'm talking to my clients about pain tolerance, and I expressed to the technician and Dr. Hall that I was probably at a 1 right here. It was extremely tolerable.
The technique is done with the assistance of hair transplant technicians who have many years of experience and have perfected the art of hair restoration.
Here's where we have the technician, and what they do is they come and they separate every hair graft. And as we're extracting those, when they're separating them, they have hair grafts that have 1 hair follicle, 2 hair follicles, 3 hair follicles, and 4 hair follicles. The great thing about the NeoGraft is you do not have the linear scar in some of the more traditional ways of doing hair transplantation. Here I am, very relaxed, very comfortable. As you can see, I have a small receding hairline. And so I had 200 grafts on each side. My procedure probably took a total of 4 hours. During the procedure, very little pain. The hardest part for me was I couldn't wear hair products. Now what they were doing is they're making small incisions to where they're actually going to implant every hair follicle. There's definitely an art to this procedure. I'm going to make sure that when they're implanting the hairs, that they're going with the same direction of your natural growth. Again, this is very comfortable. At any point, if the tumescent or the numbing agent wears off, you just ask them to inject a little bit more.
It's easily done, and your downtime is very minimal. The hair grafting is done, and then after a healing process, you should see an end result on what your final growth of hair at about 12 months.